Most insurances, Medicare, and Medicaid accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
We're back. It's Dr. Lederman from Radiosurgery New York. We understand there's a caller on the line?
Yeah, hi, hello.
How are you today?
I'm good. This is Ariel. I want to talk to you about the abstract you mentioned.
So congratulations. This is one of many abstracts that you've put together on radiosurgery.
Yes, it is.
Can you talk about, this is for kidney cancer that was metastatic to the lung?
Yeah, and it was just accepted this week. So we looked at around 80 patients who got treatment.
Uh-huh.
And of those 80 patients, we had 97% control rate.
Now, what does control mean?
That the tumor either stayed the same, shrunk, or disappeared.
So we know cancers grow. So cancers, if they grow, it's a bad thing. So 97% of your cancers, kidney cancers that spread to the lung, stopped, shrank, or went away and never came back.
Correct. And this is all done by outside radiologists. So,
okay. So what's the importance of that?
So the decision wasn't based on me. It was based on what the radiologist saw.
Right. So it's independent, because we don't want to say what... I mean, if we say it's successful, people will think we're tooting our own horn, right?
Exactly. If someone else says it's successful...
They're tooting our horn for us.
Yeah.
So what should patients take home? What's the message that they should understand about the study?
You know, not everyone... You can treat kidney cancer metastases in the lung non-invasively.
Now, have you seen in your life people who have had their lung removed for metastasis?
I've seen many patients get lobectomies for a single metastasis.
So what do you think about removal of the lung versus radiosurgery for metastasis?
If I can treat a small area of lung, why take out the whole tissue?
Well, in fact, you're not treating a small area of the lung. You're treating a small area of cancer in the lung.
Yes, and if someone has cancer, why should you cut out the whole entire lung just for a small cancer?
So why would people do that?
Well, what do surgeons do?
Well, you tell me.
You're not going to go to a surgeon and get radiation.
So what's your advice if someone has cancer that's spread to the lung or anywhere in the body? How do you
Get another opinion.
Okay, what if your surgeon says you need surgery? What do you do then?
Get a second opinion.
Well, what if he says, I'm smart, you got to get the surgery today?
You don't need it today.
So so what is a patient going to do?
You can call 212-CHOICES, and we promise to see you within one business day.
Okay, but what does a patient do? The patient's in the room, and they're intimidated. The guy's got his white coat on, and the stethoscope, and his hair slicked back, and a fancy tie, and his shoes are polished.
It's your body.
Okay, but who's making the decision?
It's your decision to make. You can walk out. If you don't like what the person's saying, you don't have to stay.
So who should have surgery for metastatic cancer? Can you think of somebody?
Well, every cancer is different, but if it was me and I had a kidney metastasis in my lung, I would rather have radiation than surgery.
Okay, what are the side effects of radiation? You did a study. What kind of side effects did you see?
It's all very local, and most of the people at 12 months have almost no side effects.
Okay, so it's very well tolerated, outpatient, there's no cutting, no bleeding, no anesthesia. So if you can have a treatment that's non-invasive versus cutting out part of your lung or all your lung, why would anyone ever have part of their lung removed when you can have non-invasive treatment?
It doesn't make sense to me.
But you see it, right?
I do see it, and it doesn't make sense to me.
No, but tell me why it happens then.
Because the surgeon wants to cut. The surgeon sees the patient, and it's the surgeon's job to cut. I'm not going to go to a baker and get a get.
Get a filet mignon. Get a filet mignon.
I go to the steakhouse to get a filet mignon. I don't go to the steakhouse to get a cookie.
All right, so
I go to the surgeon to get radiation.
Okay, so the bottom line is you did this study, and it's been accepted at a big meeting. ASTRO is the largest society of radiation cancer doctors in the world, right?
Correct. Yes, it is.
So congratulations on your acceptance of the paper. And so the take-home advice here is?
Get another opinion.
Okay. What if you go to another surgeon? They'll say the same thing. So it's not just another opinion. You have to get an opinion that's knowledgeable about other methods of treatment. Because if you go to two surgeons, they'll probably both say, what?
Cut it out.
Yeah. So what do you think about that?
Hands off my lung.
Okay. What else do you want to say?
Have a great weekend.
All right. Thank you very much, and hope you have a good weekend, too.
Thanks. Bye.
Bye now. All right. That was Dr. Ariel Lederman, and he's talking about his new paper, which was just accepted. And speaking about lung metastasis, I want to talk to a gentleman I've known. Actually, he's a good friend of mine. Known him for almost 40 years. He's a doctor. We met 40 years ago when I was a student. He developed colon cancer. Unfortunately, he did not have colonoscopy until he was diagnosed with anemia and nearly fainted. Was found to have a colon cancer. He was treated with surgery and chemo elsewhere, and then the cancer came back. He's been on chemo for about 5 years. Now, over that period of time, he lost his voice and had other symptoms, had difficulty speaking, and had abdominal pain, and just the doctors just continued more and more chemo. And he asked me about it, and I told him years ago, you may want to consider other methods of treatment. He trusted his chemo doctors, and he stayed on chemo. But eventually, the pain got so severe, and his voice broke so much. He likes to sing, and he likes to speak and tell stories, and he just couldn't do it. So he came to me finally as a patient, and obviously it's, on one hand, flattering that a friend comes, and he's a big, famous doctor, by the way, came as a patient, and we saw the mass. There was a mass in the abdomen by the root of the mesentery, big mass causing his abdominal pain. He had a mass in his airway closing off the air to the right lung, and he had another mass pinching on the recurrent laryngeal nerve. It's the nerve that controls the vocal cord, so he was not able to speak right or close the vocal cord, and because of that, air was slipping through. He was hoarse, he couldn't sing, he could barely breathe. So he had chemotherapy. The chemo wasn't working. These cancers were getting worse. So I said, well, let's treat one, and you see how you like us, and if you like our work, then we'll go on. I like to do it slowly so that patients feel they're not being pushed. I think patients need to be respected. And the treatment's short. It's only 5 treatments. They're outpatient. So we treated the mass at the root of the mesentery, which is very delicate. We treated that. The pain went away. We treated the mass in the lung. His breathing got better. And we treated the mass by the aortic arch, and his speech got better. And now it's been a year, and of all the cancers he's had, the cancers treated with chemo have progressed. The cancers treated with radiosurgery have been controlled. They've stopped or shrunken. His symptoms have gone away. He's feeling better. So this is about the end of the show. We have another show. Actually, we have 4 shows on WOR tomorrow. If you like our shows, we have one on WOR, which is at 7:10, on 1:30 a.m., 3 a.m., 6 a.m., and then 9 p.m. tomorrow night. If you have questions, please call us at 212-CHOICES, 212-246-4237. This is Dr. Lederman. Thank you for listening, and God bless you. Bye now.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. This is Rob Redstone. Till next week,
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
You know, when you're talking the big C, cancer, a lot of times people have gone through prior chemosurgery or radiation and it just didn't work or didn't get the desired effects. All of a sudden you want to get an opinion on what to do. Well, Dr. Gil Lederman treats not only newly diagnosed and recurrent cancers anywhere in the body, but definitely will specialize with those folks who already been through a process that didn't work, and now they're trying to reconfigure in terms of what they can do, and he goes one-on-one with you. In fact, he'll send you an informative booklet, DVD, and arrange a prompt meeting to discuss all choices at his convenient office located on 38th and Broadway in Manhattan. He's a brain and prostate cancer as well as body cancer expert, also treating breast, lung, pancreas, liver, kidney cancers, and more. And back in 1991, I referred my dad to Dr. Gil Lederman, and he came up with a solution for his medical problem. Harvard-trained radiation oncologist, first brought non-invasive stereotactic body radiosurgery to America. He has the longest experience treating cancer using radiosurgery with no cutting, bleeding, anesthesia, or hospitalization. So just call Dr. Gil Lederman for your cancer treatment choices at 212-CHOICES. Write that number down if you want to refer someone to call, or call Dr. Gil Lederman for that person at 212-CHOICES. That's 212-CHOICES. Two choices. Two choices. Two choices. Two choices. Two choices. Two